You bought a blood pressure monitor. You check your blood pressure at home. One morning it's 1008 T2. The next day it's 149/86. Later, it might be lower again. So what are you supposed to do with all these numbers? Should you worry about every high reading? Should you write them down? And what information will actually be useful when you talk with your healthcare professional? Home blood pressure monitoring can provide valuable information, but simply collecting numbers is only the beginning. In this video, we'll show you a practical 5-step approach. Measure, track, understand, prepare, act. First, make the measurement itself as reliable as possible. Blood pressure can change throughout the day, and the way you measure it can affect the result. Sit quietly before measuring. Keep your back supported, your feet flat on the floor, and your arms supported around heart level. Place the cuff on bare skin, use the correct cuff size, and avoid talking during the measurement. Try to measure under similar conditions whenever possible. A single reading is one piece of information, not the whole story. Next, organize your readings instead of letting them become scattered numbers. Maybe some readings are stored in your monitor, others are written on paper, some are in your phone, and maybe you've texted a few to your son or daughter. By the time you see your healthcare professional, it can be difficult to remember what actually happened. A simple record can help. Record the date, time, and blood pressure reading. When relevant, you may also note useful context, such as whether you took your medication, experienced symptoms, slept poorly, or had unusual stress. The goal is not to explain every change yourself. The goal is to create a more organized record. Once your readings are organized, you can begin to see the bigger picture. Blood pressure naturally varies. That is why one isolated reading may not tell you everything about what has been happening over several days. An organized record can make it easier to see whether readings are repeatedly higher at certain times, or whether there are changes worth discussing with your healthcare professional. But remember, a home blood pressure log is not a diagnosis, and it should not be used to change medication on your own. Its value is that it gives you and your healthcare professional more useful information to work with. Now comes one of the most useful steps. Use your record to prepare for your next healthcare visit. Imagine your clinician asks, "What has your blood pressure been running at home?" Saying, "I think it's usually around 140 gives limited information. An organized record can help you have a more specific conversation. You might ask, "My morning readings often look different from my evening readings. Is that important for me?" Or, "Here are several days of readings and my medication schedule. Is there anything you want me to monitor differently?" Better information can lead to better questions. The final step is to act appropriately on the information. That does not mean changing treatment on your own. It means following the plan you and your healthcare professional have established, continuing recommended monitoring, and knowing when you should seek medical help. Some situations should not wait for a 7-day log. If you have a severely elevated blood pressure reading together with concerning symptoms, such as chest pain, severe shortness of breath, weakness, numbness, difficulty speaking, or other signs of a possible medical emergency, seek urgent medical care. When in doubt about an unusually high reading or new symptoms, contact an appropriate healthcare professional for guidance. So remember these 5 steps. Measure. Get the best reading you reasonably can. Track. Keep your readings organized. Understand. Look at the bigger picture instead of reacting to every isolated number. Prepare. Use your record to ask better questions. And act. Use that information together with appropriate medical guidance. If you're already checking your blood pressure at home, the next step is to turn those readings into something useful. Miland Wellness created a free 7-day blood pressure tracker to help you organize home readings, add useful context, and prepare for a more productive conversation with your healthcare professional. Start with 7 days. Measure, track, understand, prepare, act. Visit milandwellness.com to start your free blood pressure tracker.